I just couldn't deal with the pain. I was to a point where I was tempting to, and I did. I almost did. On the news, I read that some lady, she had back problems, and she committed suicide. I tell you, if I didn't come here, I think I would have.
If you've had chronic low back pain for a very long time, or if you've had failed low back surgery syndrome for 20 or 30 years, there is hope. You're going to meet one of our recent patients, Al, who, when he first talked to me on the phone, because he's from Tennessee and we're here in New Jersey, he spoke to me during the consult. He told me his pain was really severe, and he said that if his pain doesn't get any better, he's going to do something about it. And when I asked him, what does that mean? He said, I'm going to commit suicide.
Back in '93, I had back surgery. S1L5 fusion. They called it a failed back syndrome. Ever since the surgery, I was in a lot of pain. They said I ruptured a disc. The second surgery, I went in that same year. That's when they fused it, and I had a lot of nerve damage. I was a carpenter. Tried to go back to work, but I just couldn't do it. The traveling and doing the 8 hours, I just couldn't do it anymore.
And Al told me that he was going to come up to New Jersey for 3 days. And I was like, Al, you're 64 years old. You've had chronic low back pain for 24 years. You're going to commit suicide if your pain isn't getting any better. I don't think that it's a really good expectation for you to have, to give me 3 days and that you're going to go back and you're going to say my pain is much better and then I'm not going to commit suicide.
I went through pain management, taking medication, Valium, morphine, Percocet, I think it was. There was a lot of drugs. I was on a lot of heavy stuff. I was so spaced out, didn't know if I was coming or going. I stopped going to this New York City for that. I tried, the chiropractor, acupuncture, the ice packs, the heating packs.
When Al first called us, he had two primary areas of complaints. His right iliac crest, which is the bony area of the pelvis and the backside. They took bone out when they did his hip replacement a couple years ago, and he just has a really big scar right over the top of the bone. So he had a failed low back surgery in 1991. He's got this scar right here, and he's got this scar right here, and all his pain has just been where the scar is. And he's had no relief from the surgery. He even had worse pain after the surgery. So a lot of what we've been doing has been unloading this, and also treating the superior colonial nerves that get entrapped as they come over the iliac crest. The second location is his actual butt cheek, the gluteal tissue that is likely coming from the disc in the L4-S1 area shooting down to the glute.
I would just either go to bed or just lay on the couch and just try to, not think about the pain and just fall asleep. Sometimes I couldn't fall asleep. I would just lay there. It was very depressing. There's a few times where I just didn't want to go through it anymore. I knew on the news, I read that some lady, she had back problems, and she committed suicide. And she was going through it for 10 years, and she said she left a note saying that she couldn't do it anymore, couldn't deal with the pain or nothing. And that really bothered me. And then, I say right after my mom died, I just couldn't deal with the pain. I was to a point where I was tempting to, and I did. I almost did. And I heard my mom's voice. She said, "Don't you dare. Don't you dare. Faith, just keep going." I was watching Dr. Chris for 2 years on YouTube, and I'll tell you, it made so much sense. I've gone to a guy in Crossville, Tennessee, and he was doing fascia, and I was doing almost 4 months with him, and there was nothing. And at that point, I kept watching Dr. Chris, and I says, I gotta do it. I told my girlfriend, Patty, I says, I gotta go. She really didn't want me to leave, But I did, and I came, and I'll tell you, it's the best thing I ever did.
Long story short, he had 30-40% relief after 3 or 4 days, so it actually did go very well. The relief that Al has gotten is all because he had significant amount of adhesions from the failed low back surgery he had in 1991, from the hip replacement he had on the left side where they stole bone from his right iliac crest, and then from all the adhesions in his belly, around his femoral nerve, his sciatic nerve, in his butt cheek, his hamstring, and all throughout the rest of his body.
I'm happy I found him. Took a long time to find somebody that can help me, and Dr. Chris did. If you can keep going, just keep pushing, and just fight, and take one day at a time, and you'll find somebody, and I mean, go on YouTube, see Dr. Chris. I mean, I came from Tennessee. I mean, it's a haul, but it's worth it. It's worth it.
He's gotten 90% relief by the time he left to go home to Tennessee last week, and he allowed us to record this video and to share with you.
I'm looking forward to getting back to hiking, doing a lot of walking that I couldn't do before, and just do housework around, the yard work that I miss doing. That's why I told Patty, I says, I miss Tennessee. I mean, I'm looking forward to going back after I'm done with Dr. Chris and do what I have to do to keep myself busy and live my life through as long as I can. The clinic is there. I feel like a part of the family here. I really do. Everybody's wonderful. I mean, to day one to now, I mean, it's amazing. The love in this place. I mean, you walk through that door, you could feel the love that everybody gives, and it's 100%. It's 100%. He's doing God's work, helping people, getting out of pain, and he loves what he's doing. And I wish there was 1,000 just like him scattered around the United States, because we definitely need people like him out there.